Hi, and welcome back to ACT on Mental Health. My name is Sean Hardy, and I'm a licensed mental health counselor based here in Fort Wayne, Indiana. This is video 4 in our series, Walking Through Acceptance and Commitment Therapy, 100 Key Points and Techniques. In our last video, we explored the core processes of ACT, how we build psychological flexibility using tools like diffusion, mindfulness, values, and committed action. If you missed that video, I recommend going back to check it out. Today, we're going to continue the journey with keys 33 through 44, where we'll focus on assessment and formulation, how we conceptualize client problems and guide treatment using ACT's unique lens. You'll learn about metaphors, workability, creative hopelessness, and how to collaboratively frame a client's experience without pathologizing it. So if you're a therapist, a student, or someone curious about how ACT works in real practice, stick around. Be sure to like, subscribe, so you don't miss future episodes. So let's get started. Acceptance and commitment therapy is part of a broader family of cognitive behavioral therapies, or CBT, but it stands out for its emphasis on context and function over content. Traditional CBT focuses heavily on identifying and restructuring maladaptive thoughts, often labeling them as distorted or irrational. In contrast, ACT doesn't aim to correct or eliminate thoughts, but helps clients develop a different relationship with them. At its core, ACT is a contextual behavioral therapy. That means we look at the context in which a thought arises and how that thought influences behavior. We're not trying to determine if a thought is true or false. Instead, we ask, is this thought helpful? Is it moving you toward or away from what matters most? This shift from changing the thought to changing the response to the thought is one of ACT's defining features. We use mindfulness, acceptance, and values-based interventions to build psychological flexibility, the ability to stay present and take actions that align with personal values, even when thoughts and feelings are uncomfortable. ACT isn't just a therapy to be understood, it's a therapy to be experienced. While cognitive insights had their value, ACT recognizes that talking about change doesn't necessarily lead to living differently. That's why experiential learning is at the heart of this approach. Experiential work invites clients to feel their way into insight through mindfulness exercises, metaphors, guided imagery, role play, and in-session experiments. Clients come face to face with the processes that keep them stuck, like avoidance, fusion, and control. Rather than describing acceptance, we guide clients to practice it. Rather than talking about diffusion, we offer activities that help clients see thoughts as thoughts and not commands. These moments often cut through habitual patterns in a way that logic alone cannot. For example, a client might know that avoiding social events isn't helpful, but it's through guided exposure and values clarification that they start to feel the freedom of showing up anyway. Therapists also play an active role in this process. We model openness, curiosity, and vulnerability. Instead of staying behind the safety of interpretations or advice, we step into the shared experience, sometimes guiding, sometimes following, but always tracking how the client is relating to the moment. Experiential learning turns the therapy room into a space of discovery. Clients aren't passive recipients, they're active explorers. And what they learn isn't just intellectual, it's embodied, emotional, and often transformative. In ACT, metaphors are not simply clever illustrations. They're powerful tools for creating experiential shifts. When used well, metaphors help clients feel what they've been trying to think their way through. They bypass logical resistance and speak directly to the part of us that responds to story, symbols, and sensory imagination. Metaphors can help a client see the futility of control, like the quicksand metaphor, or the danger of being dominated by their thoughts, like the passengers on the bus. Instead of telling someone, try to control your anxiety isn't working, we show them through metaphors what that struggle looks like and feels like. This often creates an aha moment, a realization that emerges from the inside out. ACT therapists use metaphors flexibly. They can be introduced verbally, acted out in session, drawn on paper, or even co-created with clients. The goal is not just understanding, but transformation. When a metaphor lands, clients often shift how they relate to their internal experiences without needing a lecture or step-by-step logic. But metaphors aren't magic. Their effectiveness depends on timing, relevance, and how attuned we are to the client's experience. Some clients resonate more with visual imagery, while others need a metaphor that speaks to their personal life or values. Used skillfully, metaphors help bridge the gap between cognitive understanding and behavioral change. They make the abstract real and the painful more workable, one story, symbol, or image at a time. ACT is a therapy built around processes, not symptoms or diagnoses. While it's tempting for clients, sometimes therapists, to get caught up in solving problems or removing distress, ACT invites us to zoom out. We ask, what's the pattern here? How's the client relating to their internal experience? This process-focused lens helps us avoid getting lost in content. A client might say, I feel like a failure. In a traditional problem-solving therapy, we might explore whether that belief is true or challenge it with evidence. But in ACT, we're more interested in how the client relates to the thought. Are they fused with it, avoiding it, letting it dictate their behavior? By focusing on psychological processes like fusion, avoidance, diffusion, values alignment, and willingness, we target the deeper patterns that create stuckness around situations. This makes ACT highly adaptable. Whether the issue is panic attacks, grief, OCD, or burnout, the underlying processes are often the same. Maintaining a process focus also allows therapy to be dynamic. We're not just applying techniques, we're watching in real time how the client moves through the experience and gently redirecting them towards flexibility. If a metaphor doesn't land, we pivot. If a mindfulness exercise triggers more avoidance, we slow down and stay present with that response. In short, ACT isn't about following a protocol. It's about tuning into the moment-to-moment flow of experience and helping clients engage with it in a new, more liberating way. In ACT, we often talk about cultivating an open, aware, and active stance towards life. This phrase isn't just catchy, it captures the essence of psychological flexibility. Being open means making space for difficult emotions, sensations, and thoughts, rather than trying to eliminate them or avoid them. It's the ability to say, this is here, without immediately needing to fix or flee. Being aware means contacting the present moment with curiosity and perspective. This is where mindfulness plays a key role, helping clients observe their inner world rather than getting entangled in it. It includes not only awareness of experience, but also awareness of the self as context, or the ability to notice thoughts and feelings without becoming them. And being active means engaging with life in ways that matter, taking committed action toward values, even in the presence of discomfort or fear. Many clients come to therapy hoping to feel better, but through ACT, they discover that a better life isn't just about feeling different, it's about doing differently, in alignment with what truly matters. Together, these three, open, aware, and active, form a working definition of psychological flexibility. They are not rigid categories, but fluid qualities that show up in every ACT process, from acceptance and diffusion to values and committed action. Assessment in ACT isn't about checking diagnostic boxes or assigning labels. It's about understanding processes. We want to know what keeps this client stuck. Where do they get fused with thoughts, avoid experience, or disconnect from values? A focused assessment in ACT means evaluating workability. How well the client's current patterns are serving their long-term goals and values. Rather than asking, what's wrong with you? We ask, what are you doing and how is it working? We look for patterns of avoidance, control, rigid rule following, and disconnection from the present moment. This kind of assessment can begin as early as the first session, as clients describe their struggles, the presenting issue. We're already tuning into processes like fusion, avoidance, or values confusion. But we're not just observing, we're also modeling ACT skills, diffusing from judgments, validating emotional pain, and inviting willingness. Focused assessment also means we're not chasing symptom reduction. While symptoms may change over time, they're not our primary compass. Instead, we're measuring progress by psychological flexibility. Is the client more open, aware, and active? Are they taking steps towards what matters, even with anxiety or pain? By maintaining this focus, we help clients and ourselves stay grounded in what matters most. Not just relief, but transformation. And in doing so, assessment becomes more than information gathering, it becomes part of the intervention itself. Creative hopelessness is one of the most distinct and powerful interventions in ACT. At first glance, it may sound discouraging. Why would you want clients to feel hopeless or more hopeless? But in ACT, we're not promoting despair. We're helping clients let go of the illusion that control strategies are working. Many people come to therapy with a long history of trying to fix or avoid their inner experiences. Pushing away anxiety, distracting from grief, suppressing anger, or seeking reassurance from intrusive thoughts. While these efforts may bring short-term relief, they often backfire in the long run, creating more suffering, not less. Creative hopelessness invites clients to reflect honestly on the workability of these control strategies. We explore, what have you tried? How has it worked for you over time? What does it cost you? Through this reflection, clients often begin to see that their control efforts, though understandable, aren't helping them live fuller, more meaningful lives. The creative part comes in when the client begins to consider something new. If they stop doing what hasn't worked, what becomes possible? What becomes available to them? This moment of openness is a critical turning point in therapy. It makes space for acceptance, mindfulness, and values-driven action. We're not telling clients that life is hopeless. We're saying, let's drop the struggle to control what can't be controlled and open up to something more powerful, something new. That shift can feel radical, but it's also incredibly liberating. Workability is a guiding question in ACT. Is this behavior helping you live the kind of life that you want to live? It's not about whether a thought is true or a feeling it's appropriate or behavior is right or wrong. It's about function. What impact is it having on your life? When we assess workability, we ask clients to look at the effects of their behavior over time. For example, if someone avoids social situations to manage anxiety, we explore how that strategy has shaped their relationships, goals, and sense of self. Even if avoidance reduces discomfort in the short term, it may create loneliness, shame, or stagnation over time. Workability is especially helpful when clients are fused with rules or beliefs about how things should be. Instead of arguing with them, we ask, how is that belief working for you? This question bypasses debates and invites self-reflection. It turns therapy into an experiential process of noticing, trying, and adjusting based on outcomes, not just insight. Therapists can also use workability as a compass. Rather than getting caught up in symptom checking or agenda pushing, we return to the question, is this moving the client toward what their values are? If not, it's a sign to pivot. Workability doesn't mean perfection. It means being in a learning relationship with our behavior, paying attention to what expands or restricts in our life. When clients adopt this lens, they become more flexible, curious, and courageous in how they live. Introducing clients to the ACT model can be a transformative moment in therapy when it's done right. When it's done thoughtfully, it gives clients a clear framework for understanding their internal experiences, and it also provides a roadmap for responding differently. Sharing the model helps clients shift from a symptom reduction mindset to a process-focused, values-based way of living. Rather than presenting ACT as an abstract theory, we want to make it relatable and experiential. Some therapists use visuals like the hexaflex or the ACT's triflex of open, aware, and active. Others introduce ACT concepts organically through metaphors or clients showing how psychological flexibility plays out in their real life. The key is to tailor the delivery to the client. For some, a visual diagram of the six core processes can provide clarity. For others, hearing how diffusion or acceptance has helped people face similar challenges might be more impactful. We're not lecturing, we're co-constructing understanding in a way that empowers the client. It's also helpful to highlight that ACT is not about getting rid of thoughts or feelings. It's about learning new ways to respond. We're helping them become more flexible in how they relate to their inner world so they can build a life of meaning even with discomfort present. Sharing the ACT model early in therapy sets the tone. We're here to explore patterns, build skills, and practice new ways of being, not chase symptom relief. It aligns clients and therapists around a shared purpose and gives language to the transformational journey ahead. In ACT, we often observe something called maintenance cycles, which are patterns of behaviors and thoughts that unintentionally reinforce psychological inflexibility. These cycles are driven by avoidance, fusion, or rigid rules that keep clients stuck, even when they desperately want to change. For example, someone may avoid public speaking due to anxiety. This avoidance temporarily reduces fear, which reinforces the behavior. Over time, the person may come to believe that they're incapable of speaking or broken. That belief then adds shame and further avoidance, creating a self-perpetuating loop. Maintenance cycles aren't a sign of weakness. They're understandable, often automatic strategies for self-protection. But the more we try to avoid discomfort, the smaller our lives tend to become, the less things we can do. ACT invites clients to notice these loops with compassion and curiosity, not judgment. Therapists can help clients map out these maintenance cycles visually or through journaling. What triggers the behavior? What's the short-term payoff? What's the long-term cost? Once these patterns are clear, we can begin to gently interrupt them with new responses grounded in acceptance, diffusion, and values. Highlighting these cycles also helps normalize relapse or stuck points. When clients slip back into old patterns, it's not failure. It's an opportunity to learn. The focus stays on flexibility and function, not perfection. Ultimately, breaking maintenance cycles opens up space for growth. Clients begin to unhook from the past and make room for a new way of relating to their thoughts, their emotions, and their lives. One of ACT's simplest yet most profound tools is helping clients distinguish between toward moves or away moves. That is, whether their actions bring them closer to or further away from their values. Away moves are behaviors driven by avoidance, control, or escape from discomfort, like withdrawing from social settings to avoid anxiety or using substances to numb emotional pain. These behaviors often provide short-term relief, but they usually come at the cost of long-term meaning and connection. In contrast, toward moves are values-consistent actions, even if they come with discomfort. Choosing to have a difficult conversation, or showing up vulnerably in a relationship, or pursuing a meaningful goal despite fear. These are all examples of toward moves. They're not easy, but they expand life. In therapy, helping clients track their moves in a given situation can be powerful. We might ask, was that action a step toward the kind of person you want to be, or away from it? This reframes behavior not as good or bad, but as more or less aligned with the client's values. We're not trying to eliminate away moves entirely. They're human. But we are helping clients notice them with awareness and make more conscious choices about how they want to show up. This tool gives clients a way to evaluate behavior without harsh self-judgment. Instead of perfection, we're after direction, moving step by step toward a more vital, meaningful life. The ACT matrix is a powerful visual and experiential tool that helps clients organize their internal and external experiences through the lens of psychological flexibility. It's built around two intersecting axes. The vertical axis is the internal experiences, thoughts, emotions, memories, versus external behavior. The horizontal axis are behaviors that move us toward versus away from unwanted experiences. In practice, the therapist helps the clients to fill in each quadrant. What are some of the difficult thoughts or feelings you tend to avoid? What are some of the things you do to get away from them? And what do you care about? What really matters to you? What are some actions that move you toward those values? This simple structure brings clarity to complex patterns. Clients often begin to see the cost of avoidance and the possibility of values-based actions, all within a single session. It also externalizes experience, putting thoughts and behaviors on the page, where they can be explored with curiosity instead of judgment. The matrix is flexible and accessible. It can be used with individuals, couples, teens, or groups. It works well early in therapy as a psychoeducation tool, or later as a way to check progress and realign goals. Perhaps most importantly, the ACT matrix reflects the heart of ACT, helping clients notice their internal experiences without being dominated by them, and take committed action in the direction of what matters. It's a map, not for escaping suffering, but for navigating life with clarity and courage. Thanks for watching this fourth video in our series on Acceptance and Commitment Therapy, 100 Key Points and Techniques. In this video, we explored keys 33 through 44, which focused on assessment and formulation, which is a crucial part of how we apply ACT in therapy. From experiential learning and metaphors to creative hopelessness and the ACT matrix, you've now seen how ACT provides both structure and flexibility for understanding and supporting clients. These keys help us move beyond symptom reduction to working with the whole person, their history, their struggles, and most importantly, what they truly care about. If you found this content helpful for your own learning or practice, please take a moment to like, subscribe, and turn on the notifications so you won't miss any of the upcoming videos in this series. In video 5, we'll move into the next section, which is techniques for moving these ACT processes forward. And it'll be a hands-on look at how to deepen and apply these powerful interventions. If you want more free resources, you can check out my website, seanhardy.com. You can also find the book what we're working on over on Amazon, and there's a link in the description below. Thanks again for joining me on ACT on Mental Health, and I'll see you in the next video. Remember, your journey towards a more purposeful and mindful life begins with a single click.